Okay. The boy and all right. So we had actually we had started on if you remember for video number 4, which I had sent you earlier. It contained I think I must make this small. Okay. We contain modern vaccine, mean the recent future vaccines, and this one contained dengue itself. We put on 3, and video 4 we started with malaria vaccine. We went up to 49 slides. There were catch-up immunization. That was the whole idea of the catch-up immunization. I had put up the catch-up immunization to you, send it to you, the PowerPoint presentation. That's one thing which is very practically important, but not that easy, because you must know the upper age limit of each one, the conditions in which you give catch-up immunization, up to what age you give each vaccines, etc. Now we will start with today with rotavirus vaccine. The this is showing actually question number 1 actually is question number 50 on that slide. Okay, can you read it now? Lasima, can you read?
According to the UAP schedule, how many doses of rotavirus vaccines are recommended and at what ages? A, 2 doses at 6 and 10 weeks, 3 doses at 6, 10, 14 weeks. C, 3 doses at 6, 8 and 12 weeks. D, 2 doses at 10 and 14 weeks.
Okay, can you tell now?
3 doses.
UAP schedule, that's what we are asking. Is it so difficult? You don't know the UAP schedule means the schedule in the this what you call happens in the government sector, the national immunization schedule.
3 doses at 6.
Amal, where are you?
Sir, Kekamo.
Kaka, can you hear me? Because I think the slide is slightly less today. I'll make the
3
mic
doses at 6, 10 and 14 weeks.
6, 10 and 14 weeks, is it? Yeah. Let me go back into the slide. Well, wait a minute, sorry. I don't know, something happened here. 6, 10 and 14 weeks is right. Now I'll go into. Okay. What's the doubt about it? Can you read it now?
Scheduled in a universal immunization program, the rotavirus vaccine to be administered in 3 doses, 6, 10 and 14 weeks along with other UAP vaccines.
Okay, that's the schedule. Make no mistakes. Don't make any mistakes in the schedule, because there's a bare minimum you have to know about immunization. Read it.
What is the maximum upper age limit for administering the first dose of rotavirus vaccine as per the National Immunization Guidelines?
What is the answer, Amal? National guideline.
12 months.
Huh?
6 months.
Rose, you are there? Can you?
Third months.
Okay, now read the answer.
C, 12 months. Maximum upper age limit for giving first dose of rotavirus vaccine is 1 year.
We will go into that. How you didn't know? See, this is what I say. I sent you the PowerPoint presentation. Then I ask you a question which is so fundamentally important. You must know what the highest age in which the national guidelines say you can apply to, you can give. I think it is the IAP guideline or national, I'm sure. It is 12 months. And you are not knowing it. Okay, next.
A 9-month-old infant has missed all previous vaccination. Which of the following is true regarding rotavirus vaccination? Cannot be started as per the IAP, can be started as per WHO and UAP. Only one dose is needed. Contraindicated due to age. B, sir. Can be started as per
Yeah, as per national
WHO.
recommendation, cannot be started as per UAP. International recommendation vaccine. We will come into that slide which I have showed. I'm just punching in some very important point. That is international guidelines, no. UIP and WHO recommended through 3 doses 4 weeks apart. Okay, now what's the next question?
According to WHO, up to what age can a rotavirus vaccine can be given as a catch-up? 12 months.
Well, this is a problem of being in ICU and not attending the class. Read the answer.
If a child less than 12 months
Answer
of the
is
age
B.
misses,
Answer is B, 24 months. Okay.
if a child less than 24 months of age misses a rotavirus dose or a series of any reason, WHO recommends rotavirus vaccination for that child.
Okay. Now next question.
Why does the WHO recommendation for rotavirus vaccination up to 24 months constitute an off-label use? A, because the vaccine is not effective beyond 12 months. B, because product label restrict use to younger age Rotarix by 24 weeks. C, because it causes interception in older children. D, because cold chain cannot be maintained. A ആണ്.
No, because the product, then how can the WHO ever recommend up to 24 months if it is not effective beyond 12 months? The product label, we will come into that detail. See, I'm just, what's the answer? I mean, Gopika, you are there, I suppose. Hello, can anybody else answer? Why nobody is hearing it?
Option C.
Since
So
the
B.
B, because the product is, that answer is there? Who answer?
Rasima.
Okay. ഇത് ആൻസർ ഏതോളൂ വായിച്ചോളൂ. Okay, read the answer.
This WHO recommended upper age limit for rotavirus vaccination is higher than the age restriction indicated in the product information for Rotarix, Rotatec, and Rotavac, thus constitute an off-label recommendation.
See, this is, you must understand. Now we will go into the facts which I thought you should know. If I had just read the PowerPoint presentation, you would have just read through it without understanding the significance of it. Now, Amal, yourself read it slowly now, since you did. It was very clear that you were not knowing anything about it. Okay, read it.
Schedule in universal immunization program, the rotavirus vaccine to be administered in 3 doses at 6, 10, and 14 weeks along with other UAP vaccine. The maximum upper age limit for giving the first dose of rotavirus vaccine is 1 year. If the child has received a first dose of rotavirus vaccine by 12 months of age, 2 more doses of vaccine should be given at an interval of 4 weeks between 2 doses to complete the course.
Therefore, the reference is R1 here. Note this here carefully. You have to go through the slide very carefully. Very important from the practical point. The reference is R1. I always talk with reference. And the reference R1 is a purple book of IAP guide, which is the latest IAP guidebook. Therefore, that's IAP position. The IAP position is the maximum upper age limit for the first dose is 1 year. If you are given before that, you can complete the course. But this is completely different from what will be given in the packet insert. We will come to that. See, so this is the national immunization schedule. And look at the rotavirus at 6, 10, and 14 weeks can be given till 1 year of age. Remember this, as per national immunization age as well as IAP, it can be given up to 1 year of age. Make it very clear to you. Okay. Now read the third and fourth.
If the child less than 24 months of age misses a rotavirus dose or a series for any reason, WHO recommends rotavirus vaccination for that child. Because the typical age distribution of rotavirus gastroenteritis rotavirus vaccination of children more than 24 months age is not recommended.
That's the reason. Okay, rotavirus with gastroenteritis is not recommended. The WHO is only concerned about the mortality and morbidity of the children. About 24 months is not there. While the vaccine producers are concerned about being sued because of the risk of that will come to later, I think. Okay, now read it.
This WHO recommended upper age limit for rotavirus vaccination is higher than that age restriction indicated in the product information for Rotarix, Rotatec, and Rotavac, and thus constitute an off-label recommendation for this product.
Okay, we already went through it. See, this is the, I think, IAP. I think this is IAP. My God, I didn't. Yeah, down it is there. IAP-AC recommendation 2023. That's the latest you can get. Look at the rotavirus. It is given only, it can be given up to 9.5 months. They have written up to 9.5, maybe 10 months. It's not 9.5, it's 9 months and then 12 months. There was 3 months in between. Therefore, it is 10.5 months probably you can give. Therefore, IAP, and according to the universal immunization program, you can start the vaccine below 1 year. According to WHO, you can give it up to 2 years. Remember. Therefore, if you are giving now, if you look at immunization up to 9.5 months is wrong. This should have been, it's not 9.5 months. It should have been something else. 10.5 months, I think. And if you look at the, if you have gone through the, what is the upper limit maintained for the pentavalent human by Rotatec, this is Rotarix, okay? If you look at the recommended schedule for pentavalent is 2, 4, and 6 months. The minimum age is, Rotarix, we give only 2 doses, 2 and 4 months. The minimum age is same, 6 weeks for first. The maximum age for the first dose is different in United States and Europe, okay? But we will take by United States as more time, 14 weeks and 6 days. It's not 15 weeks. Therefore, if it is 4 months and 3 weeks over, then you can't give it. You can't start the dose as per schedule in it. And the maximum last dose in the United States for pentavalent is 8 months. And for Rotarix is also 8 months, but it is 6 months in Europe. I'm a little surprised because I think this is wrong. Rotarix, I think, is 6 months. I'm not sure here. They have written sure. And one difference is that it doesn't contain latex, it contains lactase. Therefore, what you should realize is why I'm giving you so much importance is that a patient comes to you for immunization. You write injection in a private clinic, you write injection rotavirus. The patient goes through the leaflet and it is written the maximum dose is, you can give is 14 weeks and 6 days. Maximum age of the first dose, last dose is 8 months, and you give it at 9 months, you can be in trouble. Then nothing can protect you because that what is given in the leaflet is ultimate. Now, if you want to give the vaccine, the best thing to give is Rotacil, because Rotacil, I think you can give up to 1 year. You must go through the leaflet. Otherwise, you will have to tell the patient, these are the upper age limits for these patients. By the leaflet, I cannot give. But the IAP and the universal immunization, in the government sector, Amal, you're going to go and sit, just give it up to 1 year, no questions asked, because that's UIP immunization schedule, you will do it. But don't give it above 1 year. Now, in the private, if you are sitting, probably you can give Rotacil up to 2 years, explaining and taking in direct from them. They will understand that there's a Very important practical point which I pointed out. Now, can you answer this? See, if you have a 4-month-old child, 4 months means 16 weeks, rotavirus catch-up. As per international recommendation, vaccine cannot be started. As per IAP, UIP, and WHO, 3 doses 4 apart, probably you have to give Rotacil. Look at the difference that come. Because when you give a and the pamphlet clearly writes that you cannot give it, then it is dangerous to give. See, catch-up immunization, here is written the first dose, 14 weeks, 6 days. Final dose is 8 months. Therefore, this is rotavirus vaccination. Can you read the Rota Penta once more for make sure? See, here is written 3 doses, 4 to 10 weeks apart, completed by 32 weeks. That's 8 months. Rota, yeah. One thing I want, I just will go through it fast. The Rota, can you read Rotarix now, Aman? Can you read Rotarix?
Rotarix, a monovalent human rotavirus vaccine liquid. The manufacturer recommended schedule is 2 oral doses given at 4 weeks apart, beginning at 6 weeks of age. The series should be given before 16 weeks of age, but must be completed by the age of 24 weeks.
See the difference? Here is written 24 weeks. When I showed you this, it is written here, maximum age of the last dose is written 8 months. But in Europe, it is 24 weeks. But here is written here it is written clearly that Rotatec you can give up to 8 months, and this you can give only up to 6 months. If I remember rightly, the leaflet of Rotarix says 6 months. But look at the leaflet very carefully. Rotavac, go ahead. Can you read Rotavac, Amal? I can't hear you. Amal, you are there? Somebody else?
Rotarix, a monovalent human
Yeah.
rotavirus vaccine. The manufacturer's recommended schedule is 2 oral doses given 4 weeks apart, beginning at 6 weeks of age. The series should be given before 16 weeks of age, but must be completed by the age of 24 weeks.
Read downwards also.
Rotavac, a monovalent human bovine reassortant rotavirus vaccine, which is frozen liquid. The manufacturer's recommended schedule is 3 oral doses given 4 weeks apart. Beginning at 6 weeks of age, the series should be completed before the age of 8 months. Rotacil, it's a pentavalent human bovine reassortant rotavirus vaccine, lyophilized or liquid. The manufacturer's recommended schedule is 3 oral doses given 4 weeks apart, beginning at 6 weeks of age. The series should be completed during the first year of life.
Okay. Now, see here, there's a difference. They have written 24 weeks. In the other chart, we found America both 8 months. That means it's 32 weeks. And also, when you give Rotavac, it is 8 months, while Rotacil, they are given up to first year. Therefore, if you are going to give it at second year, probably you will have to explain to the patient. If the leaflet of Rotacil does not say about second year. Now, Rotavac is any idea what is this Rotavac vaccine? Anything special about it? We will come to that, but I'm just asking you ahead of time. Lasima, anything you know about, is it available in India? Where are the others gone? Any idea?
Sir, indigenous vaccine ആണ് sir.
Yeah, Rotavac is an indigenous vaccine, as Rose answered. Yeah, what is that indigenous vaccine? What is the significance of that vaccine? I think it comes in the further slides. It is a totally Indian-made vaccine. It has a history behind it. It is one of the achievements of the All India Institute of Medical Science. And they say it is completely Indian-made, though they had some license with an American university. It's a very interesting history. But they say it's only up to 8 months. Once it is written the 8 months, don't go ahead of it. Now, 11-month-old unimmunized child, international, we have gone through it. You have Rotasil, we have done it. Now, suppose it's 15-month-old unimmunized, what will you do? Normally, you may not, in 15-month rotavirus, should you give or not give is a question mark. Better not give. But if the patient comes and says, doctor, my elder child had a severe gastroenteritis, it was rotavirus, I am worried, I want to give. Can you give or not give, Rose?
Can give, sir. 2 doses can be given if it is given 1 month apart.
Yeah, as per
Better
IUCN
to vaccinate.
international recommendation cannot be WHO 3 doses. Probably it is Rotasil. Because in Rotatech and Rotarix is written that you should not give. 25-month-old, you cannot administer the patient. They will remember this. Now, this is the question which I is a little doubtful. Which rotavirus vaccine requires frozen storage?
Rota.
Rotatech. Well, it is Rotavac. You understand, human rotavirus vaccine. Now, if you look at it says, you said Rotatech is a liquid vaccine. This is again a liquid
Frozen
vaccine. Rotavac, frozen liquid. You know, the manufacturer recommend 3 dose 4 parts, the frozen liquid. But there were probably, you see, if you look at all the storage, everything, the only thing which is said about freezing vaccine requires frozen storage is OPV. And you keep in the freezing compartment only ice and OPV, no other vaccine. But in Rotavac, they have written frozen liquid vaccine. Now, if you look at now comes something about the Indian neonatal rotavirus live vaccine. Now you can read it. You must be a little patriotic. You read it, what is given. Okay, can you read it? Yes. Why is taking time? Yeah.
This vaccine developed by Bharat Biotech of India is a live, naturally attenuated vaccine containing monovalent bovine human reassortant strain characterized as G9P with the VP4 of bovine rotavirus origin and all other segments of human rotavirus origin. The vaccine strain was isolated from asymptomatic infants' mild diarrhea by Indian researchers in 1985 at All India Institute of Medical Sciences, New Delhi. Follow-up of these infants indicated that they were protected against severe rotavirus diarrhea for up to 2 years. It can be stored at minus 20 degrees Celsius till the expiry date. It can be stored up to 6 months at 5 degrees Celsius plus or minus 3 degrees Celsius at any time during shelf life. Rotavac 5D can be stored at 5 degrees Celsius plus or minus 3 till the expiry of the shelf life. The same vaccine is also marketed by Abbott as RotaSure.
Okay, therefore the importance of this is a very famous gastroenterologist of All India Institute, Dr. Bhatt. He observed that many children in newborn period, their stools contain rotavirus, live virus 116E. This strain, but they never developed sickness. And these children in follow-up never developed gastroenteritis due to rotavirus. Therefore, he thought that as if this is a human virus, it does not produce a disease. It is not a manufactured or attenuated virus. I mean, this is not from an animal source or anything. Therefore, what he said is, let's give this as a vaccination. That started about 20-25 years. He brought about the Rotavac virus. Now, here it is written to our question can be stored as minus 20 degree expiry date. Now, there are a few questions which are asked here. I would like to ask you in this, certain terms are used. What is resortant rotavirus? What do you mean by resortant? Can you say, anybody? Yes, Amal, carry on.
Sir, connection broke.
Huh?
വായിക്കട്ടോ sir?
അതല്ല, what is resortant rotavirus? What do you mean by resortant? Reassortant.
Yes.
What do you mean by pentavalent?
5 vaccines combined.
5 strains probably. Monovalent means it's one strain. Human, this is human. This is resort means a combination of human and bovine. This is again a combination of human and bovine. Everything is a combination of human and bovine except Rotarix, which is purely human. I'm a little surprised that Rotavac they say is human bovine because I thought it was 116E human strain. Anyway, and remember that only frozen Rotavac at all can be done is this one. Okay. Now this we have seen already. We'll go to the next. Actually, I was a little surprised at what was monovalent and pentavalent, what they are derived. Monovalent is Rotarix. Okay, read what is given in the bracket. This is Chat GPT. I asked Chat GPT the question and it gave me the answer. Okay, you read it.
Monovalent rotavirus vaccine Rotarix coverage provides protection against G1P, the most common global strain, and cross protection against other major strain.
They were, yeah, okay. Pentavalent.
Pentavalent rotavirus vaccine, that is Rotatech type pentavalent live attenuated vaccine strains used to contain 5 reassorted rotavirus developed from human and bovine strain covering G1, G2, G3, and G4 common G types, P8 common P type.
Okay, that's enough.
Doses.
Yeah, you read the last 2 lines also.
Doses given in 3 doses at 6, 10, and 14 weeks or 2, 4, and 6 months of age. Coverage provides broader protection against 5 most common rotavirus types.
Therefore, now, if you read it, I just want to see you. See, just resortant means it contains 2 types of DNAs. That's what it means. Now, I just want to teach, in many other places also they are given that the monovalent vaccine cross protection is but narrower range. But this gives a pentavalent gives a broader coverage. Now, but you know what happens? Both vaccines are highly effective against severe rotavirus gastroenteritis. Severe, remember this. And why? Because you can still get diarrhea due to rotavirus, but it will be minor. And I can vouch for it. Once you give rotavirus vaccine, the number of children who come to you with will require IV fluids is very much restricted. Either vaccine can be used. See, the problem is though we said here broader coverage, 5-valent or monovalent, etc. WHO states either vaccine can be used depending on immunization. Some countries prefer Rotarix for easier 2-dose schedule, while others prefer Rotatech for the broader strain coverage. Now, this is what WHO, why does WHO, if you look at PCV also, initially when only PCV 13 and PCV 10 was available, they will always say either vaccine can be used. The reason is very simple, because if you allow only one vaccine into the market, they will start hiking up the price. Therefore, WHO always wants competition. If you read in between lines, Rotatech must be better because of its broader coverage. But Rotarix is 2 doses. That's not the matter. Now coming to the freezing, we found that Rotavac can be freezed. But if you look at the storage protocol, which in IAP guidebook, only OPV vials can be stored in freezer. Okay, maybe they are not aware of Rotavac and rotavirus in the middle shelf. Remember that. Top shelf is OPV, freezer dried vaccine, BCG, etc. And it doesn't even say Rota in the top shelf. It says in the middle shelf. Probably Rotavac, they are not sure. And Rotavac is the only vaccine. I have told you several times, go to the immunization and find out where is Rota. Do we have Rotavac in our hospital? Do we have or don't have? Amal, what do you say?
Rotatech ഉണ്ട്.
Rotavac ഉണ്ടോന്നാ ചോദിച്ചു.
Rotavac.
Yeah,
Yes.
okay. There's an Indian strain, remember this, okay? Rotatech is there Rotacil is there. Okay. Now coming. Can you tell me? Yeah. Read it.
7. For a Rotarix, what is the minimum interval between the two doses?
What is it?
4 weeks.
Yeah, for all live vaccine is 4 weeks. There's nothing great in that. Okay, this is a repetition. What age till rotavirus series can be completed? Quick, just now we answered that.
1 years.
Huh? We have not observed it. Lasima?
20.
Yeah, 24 weeks. Rotarix 24 weeks according, but in that what the table it gave us 32 weeks in Europe and in USA and 8 months in USA and 6 months in Europe, but generally Rotarix is 24. Okay.
Which rotavirus vaccine is pentavalent and lyophilized or liquid? Rotatex.
Okay, Rotatec. Rotacil is also pentavalent. Both are pentavalent, and I think both are liquid. Okay. I think both are lyophilized liquid, but I have written Rotacil. Okay. Okay. Okay.
At 10, a child received first dose of rotavirus vaccine at 10 months of the age. How should the schedule be completed? 2 more doses at 4 weeks interval.
Yeah, 2 more doses, 12 months or dose. This is as per the national IAP national guidelines. You can give up to 1 year. Therefore, 2 doses can be given. If a child less than 24 months missed rotavirus dose for injuries, the W recommended vaccination for the child. We have seen this. Okay. If I have gone through the same, I want to emphasize it that you can give up to 10.5 months. It's not 9.5 months, it's 10.5 months. Okay. That's it. And I want to emphasize the minimum age that is given. Okay. Now we go to varicella vaccine. Can you read it?
What is the recommended interval between 2 doses of varicella vaccine in catch-up for a 10-year-old child?
Only Amal is there, nobody else is there in the
4 to 8 weeks.
4 to 8.
4 to 8 weeks. Okay. Who answered? Somebody answered. Okay. No, I think I'm missing it very often. 4 to 8 weeks is a 10-year-old child. It is 3 months. This is what happens. For catch-up immunization, children below 13 years should receive 2 doses of 3 months apart. Now, I will come to that later. See, there are certain situations in which you feel you can wait a little. If you space the first and second dose more, what happens is the immunizing antibodies survive for a longer time. You're protected for a longer time. Therefore, you would like to give it, if it's not an emergency, 3 months is better. But the next question is, a 15-year-old unvaccinated adolescent catch-up, what is the recommended dose interval? Anybody can answer. What's it?
3 months.
3 months.
6 months.
See, it is what is the recommended dose interval is actually 4 to 8 weeks. The reason is simple. Adolescents about 13 years who are unimmunized are likely to get varicella because they go to school about everything else. I don't know, that might be the reason or something else, I don't know. Therefore, remember, there are subtle differences which you have to know. Therefore, before you administer, you must know this. This is about 13 years. It is 4 to 8 weeks. Remember, live vaccine you can give in 4 weeks interval. Definitely. But what happens is because the antibody level in the first would decrease the multiplication of the second live vaccine you are giving, it may not be that effective. But in an emergency, you have to give. A 13-year-old child unprotected going to a college, or you want to give, you give at 4 to 8 weeks interval. This is given in purple book. You can read it. Varicella vaccine. Can you read it?
Varicella vaccine for catch-up vaccination, children below the age of 13 years should receive 2 doses 3 months apart, and those aged 13 years or more should receive 2 doses at an interval of 4 to 8 weeks.
Generally, live vaccine, MMR, etc., can be given 4 weeks apart, if that's what it is. Now, I just ask you across, you must know what's the interval of viral hepatitis A, what's the interval in HPV. These are different. Okay, varicella, below 13 years, it is 3 months apart, and those 13 years and more is 4 weeks apart. Okay.
According to WHO, what is the minimum interval between 2 doses of HPV vaccine?
HPV is killed or live?
3 months.
3 months ആണോ എന്നാണോ? Okay.
Months.
Yeah.
6 months.
6 months. Okay. Okay, you're right. 6 months. You see why? Because human papilloma is not an emergency. We would like to have the antibody level to the maximum limit. You have given, nowadays, WHO says even a single dose is enough sometimes. Therefore, you can wait. It's not an emergency. Yes, you can give after 4 weeks. You can give after 3 months. But when you space out by this one, the antibody level will space for a longer time. Which HPV vaccination schedule? Read it now.
Which HPV vaccination schedule is suggested for programmatic efficiency by the WHO?
Little tough questions. If you had seen my slides carefully, you would have answered it.
3 doses, 0, 1, 6 months.
6 months.
0, 1, and 6 months. From one end of Kerala to the other, everybody gave a wrong answer. This is given in this is what happens in our MCQ when you are asked. We will come into the slide later. Can you read the answer? Now, to tell you honestly, I also did not know the answer. I also made a mistake. Therefore, don't be upset about it. Okay.
A 12-month schedule resulting in higher GMTs and is suggested for programmatic and efficiency reason.
Okay. Therefore, see, please understand one thing. Why does the WHO start giving? Why does the immunization start giving the first dose at 9 months for HPV vaccine? The thing is that it should be given before the first sexual contact, and in Western countries, that is happening by 9 years. I'm sorry, by 9 years. You can't imagine it in Kerala. I cannot imagine it, but maybe in Kerala is also changing. Whatever it is, therefore, if you are given one dose, most probably you are given it too early. You can very well wait for 12 months for the next dose, spread it apart, and there's highly GMT. This is where your knowledge comes into effect, practice in the patient. If you find a 13-year-old girl or a 14-year-old girl coming, you can give it after 5 months, but if you are a very good doctor and you know the family, you can probably say give it after 12 months. That will produce an higher GMT.
Is there a maximum recommended interval between HPV vaccine doses?
HPV vaccines are killed vaccines. Though it is a human papilloma virus, it is not a live viral vaccine, as far as I know. Yeah. What's the interval? 12 months, 24 months maximum interval.
5 years.
Somebody is answering for, I think, yeah. There's no maximum reckon between doses. All right. Now read about everything about the HPV vaccine. Don't make this mistake again slowly. Okay. Read it. Mind you, I'm sorry, I
W-
will interfere here one thing and tell you something. This is Human Papilloma Virus WHO Position Paper 2022 update. Therefore, it's given in the Purple Book of Immunization, I think. I'm not too sure whether I took it from there or directly from the position paper. Therefore, your examiners, if they have not read the 2022 and read the earlier one, there might be subtle significant differences. Okay, go through it.
WHO position vaccination schedule, two-dose schedule. The current evidence support the recommendation that two-dose schedule be used in the primary target group from 9 years of age for all older age groups for which HPV vaccines are licensed. The minimum interval between the first and second dose is 6 months. A 12-month schedule resulting in higher GMTs and is suggested for programmatic and efficiency reasons. There is no maximum recommended interval between the doses, and longer intervals up to 3 or 5 years can be considered if useful from a program perspective.
Okay, therefore, these are all points written from the WHO position paper. Two-dose schedule is what they have said. Okay. Okay, there's something missing in it. Maybe it will come up later. Now read it.
As per the WHO, can a single dose of HPV vaccine can be used as an off-label option.
Ashwati is not joined. Who's on duty today?
Only two dose
Paris
schedule.
and
Only two-dose schedule. May I ask you who's on duty today in the ward?
Ashwati.
Paris and Ashwati. As usual, Mohsen is missing. Is he coming to the hospital now? Hello?
Mm.
He has not attended in the last 3 times. I will have to report it to Dr. Anandam, I think. As per, okay, single dose has been used off-label. Lazima, you were not attending regularly. Majida is there?
Yes, sir.
Which is the answer? Well, you were busy in Taiwan, I think. Okay. Amal, what's the dose? Does WHO advise a single dose HPV vaccine as an off-label option?
Yes,
Yes.
only in girls.
Can be used in girls 9 to 20, in girls and boys 9 to 20 years of age. Actually, it is not so important to give it in boys, because human papilloma virus causes carcinoma of the penis, condyloma. There's so many. Previously, it was only recommended in girls. Later on, they insisted on boys, probably. Therefore, girls are the most important thing. Anyway, all age group girls and boys, why do they say single dose? Because it's a very costly vaccine. I must say that IMA is doing a very good work. They are giving it 1,500 rupees or something. They are producing so many times. I've seen it in the our group coming that people can come and take. And many families have taken, doctors have taken for their children. Okay.
What is the primary advantage of single dose HPV schedule from a public health perspective? Improved coverage and affordability.
Improved coverage and affordability. Program more efficient and affordability. Now read this WHO position paper 2022. You can read the whole thing.
Alternative single dose schedule. As an off-label option, a single dose schedule can be used in girls and boys aged 9 to 20 years. Data from immunogenicity trial, the post-hoc analysis of efficacy trial, the post-licensure observational studies among females have demonstrated that a single dose of HPV vaccine is sufficient to elicit an immune response that provides similar protection as a multi-dose regimen against initial and persistent HPV infection. This may offer program advantages and be more efficient and affordable and contribute to improved coverage. From a public health perspective, the use of a single dose schedule can offer substantial benefit that outweigh the potential risk of a lower level protection if the efficacy wanes over time, although there is no current evidence of this.
This is what it is, maybe 2 dose may be more efficient, but the impact will be more with single dose because more patients will take it. Therefore, remember, this is WHO position paper in 2022. Previously, this was not, it was not there, to tell you the truth. Only late there, because this is giving a single dose of a killed vaccine, I don't think is very advisable, but that's WHO's portion. Even a single vaccine can be given. Therefore, therefore, if you want to know it, if you want to give human papilloma virus below 15 years, I think 3 doses are advised. That is 0, 6 weeks, and 6 months. If I'm right, that's what is advised, I think, in what is it? See, previously from 9 years to 15 months, 3-dose schedule was advised. Now they have gone back to 2-dose schedule, or straight from 9 and 15 years onwards, 2-dose schedule was previously advised. Now from 9 years itself, they are advising 2-dose. Now they have cut it down to single dose off-label for girls and boys up to 20 years. This is the position. You must know it very carefully.
In a 7-year-old child with unknown vaccination history, which vaccine should be used for the first dose in catch-up series?
Okay.
TDAP.
TDAP. Okay. Now, what is the difference between TDAP and DTAP?
Diphtheria small component is present in TDAP.
What is small component? Less antigen. You understand? Less antigen. DTWP is given only up to, wholesale vaccine is given only up to 7 years. TT is no longer available. TD is available. They didn't put TD here. TDAP is the right answer, at least 1 dose of TD. Now we are coming to TDAP. Are you giving TDAP in Aster, doctor?
Yes, sir.
We are giving. Okay. But mothers are getting it, is it?
Yes, sir.
Okay. Okay, so you can give TDAP at 7 years, and then you can continue with TDAP or TD. Will you continue with TDAP or will you continue with TD? What's the answer? You gave a child unimmunized, okay? The child comes at 7 years. You give a TDAP, no question. Rose has also answered like that. That's right. Now, Lasima, can you tell me, he comes, we want to complete the immunization series in 0, 6 weeks, and 6 months, or the primary doses has to be given 0, 6 weeks, 6 months. What will you give at 6 weeks and 6 months? It is given here TD or TDAP. Which will you prefer? Huh?
TDAP.
TDAP or TD? Here is written TD or TDAP. Actually, if you give TDAP, it will be better. But the problem is, it's a very costly vaccine, 1,200 rupees or something. If the patient can afford, right. If they cannot afford, at least give TD. Okay. We'll come to that a little later. Okay.
After completing a 3-dose primary series in adolescents, how often should TD or TDAP booster be given?
Every 5 years.
Every 5 years, yes. Amal?
Every 10 years.
Every 10 years. In Trivandrum, we will give every 10 years. Calicut, we will give every 5 years. Okay, read it.
Following the primary series, booster dose of TD or TDAP should be given every 10 years and thereafter.
10 years thereafter. Now, please remember this, that according to the National Immunization, I think according to IAP also, they say only up to 10 years. After 10 years, to give every 10 years of age. They don't say about giving the immunization, IAP, ACBAP recommendations are only up to 18 years. Therefore, but they have written that you have to give it every 10 years. Now we will come into a reference of it. Every 10 years, you can give TD or TDAP. And in fact, currently they're right. There's no evidence that Tdap is superior to TD. But definitely Tdap can be advised. It is better to give Tdap. Okay, now you go back to the reference. This is Indian Academy of Pediatrics advisory for committee in adolescents 11 to 18 years. Adolescent immunization. Read it. Adolescent immunization, told you, it will be a topic which can be asked as a short note. Therefore, the vaccine you give is, can you read, Amal?
Tdap preferred to TD followed by repeat TD every 10 years.
Okay.
Two doses at
Yeah.
6 and 10, 0 and 6 month age, 9 to 14
That
years.
is HPV. That is HPV vaccine. Okay. $15 above, they had, sorry, it's 0 to 6 months, 2 doses, 9 to 14 years, and above 15 years, they are
The
advised
HPV vaccines.
3 doses. That is about HPV. Remember carefully, in adults 11 to 18 years, adolescent age, there is only 3 vaccines. Tdap, human papilloma virus, and COVID vaccines, of course. Now in Tdap, they say every 10 years. It can be TD also, preferred to TD, followed. The first dose at 10 years, you should give Tdap. 20 years onwards, you can continue to give TD. But, you can give Tdap also if you can give it. HPV, human papilloma virus, 9 to 14 years, 2 doses, and above 15 years, 3 doses. That's a standard recommendation. Okay, that's what is given in Purple Book. Indian Academy of Pediatric Advisory Committee. Now they reduce it into 2 doses for all, and WHO even says single dose. Remember this. Can you read it now?
A 9-year-old receive a dose of Tdap
Not
inadvertently.
Tdap, DTAP.
DTAP inadvertently. What is the correct management?
You didn't know it. You just gave DTAP to a 9-year-old child. What you will do here is not tell the parents anything about it. What you should do correctly. See, above 7 years, you are not supposed to give DTAP or DTWP. You are supposed to give TDAP. Instead of it, you get DTAP at 9-year-old child. What will you do? Rose, what will you do?
Count it as Tdap and
Adolescent dose 11. You're right. Okay. Read it. See, these are very practical questions. The slides, I already sent it to you. It was there in that. And you're not answering it now. Now, when tomorrow a patient comes like this, what will you do? The sister will call a doctor. Don't tell the parents I gave like this. What should he do? You must be able to go and tell them. Forget it. Continue as a TDAP as the adolescent dose 11 to 12 years. You can give TDAP. Give this as read it. What's given here? And the answer.
If DTAP or DTWP is administered independently to an incompletely vaccinated child aged 7 to 9 years, this dose should be counted as Tdap dose, and the child should receive an adolescent Tdap dose at the age of 11 to 12 years.
Yeah, that's it. Okay, now next.
A 12-year-old receive a dose of TDAP. What should be done?
See, he should have received TDAP. Instead of it, he received DTAP. See, you must use your common sense also. What's the difference? He received a higher dose of D, and he's alive and kicking. Therefore, you are lucky. What will you do?
count as Tdap and no further doses needed.
Count it as a valid adolescent dose. Okay, read the answer.
If DTAP or DTWP is administered inadvertently to a person aged 10 years or old, this dose should be counted, and the adolescent Tdap dose routinely administered at the age of 11 to 12 years.
Okay. Now you read the whatever the 1 minute. Can you read it?
Yes, sir. Catch-up immunization recommendation in adolescents, children and adolescents 7 to 18 years. Catch-up immunization
1 minute,
recommendation
1 minute,
for
1 minute, 1 minute, just a minute. Okay, you read it from this. Okay.
children and adolescents 7 to 18 years. Children and adolescents aged 7 years or older, adults should have never received a containing vaccine or whose vaccination history is unknown should receive 3-dose series. In this situation, Tdap for the dose 1, followed by 4 weeks later by Td or Tdap for dose 2, followed at least 6 months later by Td or Tdap for dose 3. Following the primary series, the booster dose of Td or Tdap should be given every 10 years thereafter. The vaccination series does not need to be restarted for those with incomplete DTAP or DTWP history, regardless of the time that they have elapsed between the doses. Children aged 7 to 9 years, the children aged 7 to 9 years who receive a dose of Tdap as a part of catch-up series, and adolescent Tdap dose should be given at the age of 11 to 12 years. A Tdap dose is administered in children 10 years or older. It may count as an adolescent Tdap dose.
Okay, that's all. See, if you use your common sense, you will understand what to do. You understand. But it's given in this one. If you are given a TDAP at 10 years, 9 years, you will give it at 10 years again. But if you are given to a 12-year-old child, that will be counted as the adolescent dose. Now, I think, anyway, that is over. Now we will, that do 1 minute. Now read what is given here. 1 minute, let me see whether this. Now, pregnant women, we are not very much consulted, but it's better to read it. Pregnant women, can you read it?
Pregnant women to prevent neonatal tetanus. Pregnant women who have completed the childhood schedule should receive a dose of Tdap. Incompletely vaccinated or unvaccinated women should receive at least 2 doses of which one should be Tdap. If more than one dose is needed, either Td or Tdap may be used. The 3-dose primary series should be completed at the recommended interval of 0.16 months in unvaccinated.
Okay. Now, let me tell you, in pregnant women who have completed the vaccine, that what they say 3 primary doses, we have read it before, need receive only 1 dose. But I think all our pregnant women are receiving 2 doses. Am I right, Rose?
Yes, sir.
2 doses, but they are advising. And another thing which the WHO is now telling is the maximum number of TT you should receive in a life is only 6 doses. If you have already received 6 doses, then in pregnancy you need not receive. Because the more the number of doses of TT, about 6, the side effects are more. That's something. But anyway, children who have pregnant who have completed the childhood schedule, is it the booster dose? Is not. When we read about the TT previously, it was written 3 doses, 3 plus if they have received. That's all you should, 1 dose is enough. But anyway, we are not very concerned about it. Now read this.
Advisory Committee on Immunization Practice MCQ in 2018 concluded that due to higher cost of Tdap relative to Td, uncertainty about the impact of multiple Tdap doses on pertussis control and transmission, evidence appeared to be insufficient to preferentially recommended Tdap to replace Td. There is no advantage in replacing Td with Tdap for the Denisian TD booster, tetanus prophylaxis for wound management, and for the additional required doses in the catch-up immunization schedule if a person has received at least 1 Tdap dose.
Well, this is the recommendation of the ACIP, Advisory Committee on Immunization Practices. Now, 2018, ACIP is American or Indian?
American.
American. Therefore, this is the American. You understand? Advisory Committee on Immunization. Others, Advisory Committee on Vaccination and something else it is. Indian is known as. Therefore, even there, they say that because of the higher cost, TD is enough. Once you are given one dose at 10 years, they only advise one dose. But the point is that we would like to prevent whooping cough also in adolescents and young females, in the at young adults also, because the newborn baby is likely to get it from them. Therefore, which will you give? It is up to you. They everywhere in our recommendation they have written TDAP bar TD. TDAP bar TD. Okay. Here it comes. So what is that?
For pregnant women who are unvaccinated, what is the recommended tetanus toxoid schedule?
Yeah.
3 doses at 6, 1 and 6 month, one being TDAP.
One by we gave the answer just now. Okay. Because that came up. Okay. I read it.
What is the preferred vaccine for pregnant women to prevent neonatal tetanus if they have a completed childhood vaccination? TDAP.
Okay. Okay, oh, that's okay. Now, pregnant women, that's you should have read it now. Anyway, we read it earlier also. Okay, now.
According to IAP, when should TDAP be administered in fully immunized children?
Is it so difficult? Ella, that is the child has received all the vaccination, even the booster at 5 years. When should the TDAP be given?
10 to 11 years.
10 to 11 years, right, Rose? You're right, 10 to 11 years. That's in those children who received all the therapy. TDAP should be a single dose at 10 to 11 years. Okay, now.
For catch-up, if
I
a
think this is a
9-year-old
relevant question. Okay, yeah.
for a catch-up, if a 9-year-old received TDAP, when should the next TDAP dose be given?
I think the question was asked before.
At age
What age? It was there in the previous slide. Rose, can you say? Placima, anybody?
11
11 to 12 years. It was there in the previous slide. For children who receive TDAP as part, adolescent TDAP should be administered at 11 to 12 years. Okay. I think we went through it already. Therefore, I'm not going to make you read it again. Okay. We went through it. Okay. Now, meningococcal vaccine. Can you read?
Which meningococcal vaccine is licensed as a 2-dose series for a children 9 to 23 months?
Enactra.
Are you giving it routinely, Aster in Aster? Doctor?
Yes, sir.
Okay. Which children will you give it?
Those are before splenectomy to prevent the infection capsulated organism.
All right. Now, a mother comes and tells you, asks you, doctor, should I take meningococcal vaccine? What will be your answer?
If there is a definite indication of getting,
Yeah, she's
I
asking, what is the definite indication? She says, doctor, I'm really worried. You know that I'll tell you I have put up a video. Should meningococcal vaccine be given routinely in private practice? There's a video which I put up 3 or 4 years ago. I went through it now. I was surprised that so many information I got it back from what I had said at that time. Now, this is a point. You are in Aster. Mother comes and says, doctor, I know that my child has received immunization in the government setup, but I find that certain vaccines which are available in the market has not been given. And so is advising for meningococcal vaccine. Should I give it or not give? Maybe tomorrow Amitabh Bachchan may advise it, or Mohanlal may advise it. Should I give it or not? What will be your answer? Don't give it at all. If it's an immunocompetent child, there's no indication to give. What will be your answer?
If they are immunocompetent, there is no need if they are staying here in this country only.
Okay, therefore you need to say that meningococcal is not there. All right. What does Amal say? സ്വന്തം കുട്ടിക്ക് എടുക്കുവോ അമൽ?
ഇല്ല സർ, മെനിങ്കോകോക്കൽ ഔട്ട്ബ്രേക്സ് ഉണ്ട് സർ, അതുകൊണ്ട് എടുക്കുന്നതായിരിക്കും നല്ലത്.
Yeah, the answer is like this. It is, you will have to tell the patient the government of India does not advise, neither does the IAP advise for a normal immunocompetent child. But is a but. What is that but? Meningococcal is a disease which kills a child within hours, even an adult. Within hours. Many of them, you may not even make a diagnosis. You may find children, suddenly you will find in the Asianet or somewhere, child came with fever to the clinic. Next day morning, it was dead. There's a big shouting. It can be meningococcal, many other diseases. There's one disease which can kill. And it occurs in epidemics in seasonal, maybe 4-5 years, etc. I will send the link on my what I have written, what is there in the video. Therefore, what happens is, therefore, there is a disease in which it can kill the child, a very competent child, within hours. Therefore, if they want, and there is a vaccine which is very well available. Therefore, if the parents are worried, better give it. There's nothing wrong in it. Now, in Gulf, I used to say very importantly to the parents, now I tell you, don't give. What happens is, in some particular school, one child will die. And the Gulf news, the paper will carry, the pediatricians has said, it could be meningococcal vaccine. That's all. Sometimes it occurs with rash, sometimes it's proved, sometimes it's only a sudden death with fever. It could be meningococcal vaccine. Everybody will rush to take the meningococcal vaccine. It won't be available. Therefore, put it on them. This is a disease which is, as per all guidelines, it is given only for patients with splenectomy, complement deficiency, etc. Now read it. Now there are two vaccines available. 9 to 23 months, it is Menactra. Okay. Menactra, this vaccine is licensed for use in 9 to 23 months. The other vaccine, what is available? See, this is called an quadrivalent vaccine. What are the strains you know?
ACVW13.
W13. Is there a strain called meningococcal B? We'll come to that later. Okay. Which meningococcal conjugate were here? The answer came along with that. Okay. Read the answer. Read the question now.
Which meningococcal conjugate vaccine use CRM197 as a carrier protein? Answer is Menova, a second quadrivalent vaccine conjugated to CRM197, ACW135, and YCRM.
See, what you find here is group B is not present anywhere. B vaccine. You understand? Even in the quadrivalent, B is not there. Can you tell me the relative significance of these vaccines? What is A? Strain A. What is it important? Lasima, you are there? I think everybody has left. How many are there? I don't know. Anyway, Rose, can you answer? Strain A.
അറിയില്ല sir.
Okay. W135. Two things are very important. Strain A, because remember, is what is A for Africa. This is the epidemic one which kills in Africa. Therefore, that's the one which causes epidemic. It is the one which causes epidemics in India also. But in Africa, it is terrible. And then you have W135, is a strain which usually in Hajj pilgrims are found. Now, B is missing here. because it's very difficult to make vaccines against meningococcal B. But meningococcal B is an important cause of what you call meningococcemia in Britain. And therefore, there they are giving B vaccine separately, I think. Okay, go ahead. Now read it.
Quadrivalent meningococcal conjugate vaccine. A quadrivalent ACW135Y meningococcal conjugate vaccine using diphtheria toxin as a carrier protein, Menactras Sanofi, administered as a one dose, is licensed for individuals 2 to 55 years of age. A two-dose series of this vaccine licensed for use in children aged 9 to 23 months. A second quadrivalent vaccine conjugated to CRM197, ACW135Y CRM, Menova Galaxo. In some countries, this vaccine is licensed for individuals 2 to 55 years of age.
That's a very important point. That is, the two-dose schedule license for both are licensed 2 to 55 years. But if you want to give for a 10-month-old child, infants are with die. You can't give before 9 months. Remember, you can't give, you must know the minimum age. Measles, you can give minimum age is 9 months. Epidemic, you can give at 6 months. For example, hepatitis A, you can give at 2 years, but minimum age is 1 year. Remember that meningococcal vaccine, the minimum age is 9 months. They have not written what happens if there is an epidemic. You can only give Minactra. Minerva, you can give only at 2 years of age. These are all quadrivalent conjugate vaccine. Okay, now read it.
Which group of travelers must receive quadrivalent meningococcal vaccine within 3 years before travel? Hajj pilgrims.
Yeah, Hajj pilgrims. The answer also came. Vaccination 3 years before date of travel is very important. Now, another group of patients where we have to decide on vaccination is now it has become less when people go abroad, especially the American universities. They want the vaccination, meningococcal vaccination, to be taken because meningococcemia is more common when adolescents and adults come together in army barracks, when students come and stay together in a hostel, etc. Now,
For travelers to African meningitis belt, what is the recommendation if the last meningococcal conjugate vaccine is given 6 years ago?
may not be very important for you, but somebody is going to Gambia, or nowadays people
No.
go for what they call tourism also to African countries. And they ask you, doctor, what vaccine should you take?
Booster dose is recommended.
The combination last meningococcal was given 6 years ago. The booster dose is recommended. Huh? Okay,
Correct.
read it, answer.
A booster dose of a meningococcal conjugate vaccine is needed if the last dose was administered 5 or more years previously.
Now you read what is given. This is about international travel other than America. We are just talking about. Okay, read about Hajj.
Hajj.
Yeah.
Hajj pilgrims, vaccination in the 3 years before the date of travel is required for all travelers to Mecca during the annual Hajj. The quadrivalent vaccine is preferred for the Hajj pilgrims and international travelers as it provides added protection against emerging W135 and Y disease in these areas. Travelers to countries in the African meningitis belt. A single dose of monovalent or quadrivalent vaccine is recommended. Conjugated vaccine is preferred to polysaccharide vaccine. A booster dose of meningococcal conjugate vaccine is needed if the last dose was administered 5 or more years previously.
Do we have a monovalent A vaccine in India? Because that's the commonest, which causes epidemics, is the one which causes devastation in Africa. Is it available in India? We know Menactra and Minova are available in India. What about monovalent A vaccine? Which company manufactured? Do you have any idea? It's the Serum Institute. And you know the funny thing about it is not available in India. It's available in Africa. And according to Lancet, the impact that it has produced is phenomenal because they brought down the cost and they are given all over Africa. Thousands of children have been saved. Many epidemics have been because of this monovalent meningococcal A vaccine. Anyway, now you can Indian Academy of Pediatrics recommendation for doses. So when will you give? Can you read what is highlighted at least?
Indian Academy of Pediatrics IAP now recommended the use of a meningococcal conjugate vaccine in different categories as per the following description. During disease outbreak, due to limited efficacy of polysaccharide vaccine in children less than 2 years of age, conjugate vaccine should be used for the protection those aged 12 to 24 months, particularly many disease.
Many disease. Now remember, that's all. You're going to read only what is highlighted. Therefore, one is during outbreaks. Okay, outbreak I think is more than 2 diseases or something, 2 vaccines or something. Now, Dr. Rose, if you find a child with a rash, okay, with a non blanching rash, will it be blanching or non-blanching?
Non-blanching.
Okay, you do what you call it as a tumbler test or a slide test you do. You find a child with a rash, what will you do to the child first?
Administer the first dose of antibiotic.
Yeah, administer the first dose of antibiotic. Previously, it was penicillin. It is not available, give ceftriaxone. And then immediately the relatives will have to be given rifampicin, etc. Usually is meningococcal A. More than 1 or more than 2, I think, is an epidemic. What is an epidemic is not given here. Now, what's the next? This one, children with terminal complement competent deficiencies. Okay, read what is to be given. Can you
A
read?
2-dose primary series of meningococcal conjugate vaccine administered 8 to 12 weeks apart is recommended for person aged 24 months through 55 years with persistent deficiencies of late complement component pathway. A booster dose should be administered every 5 years. Children who receive the primary series before their 7th birthday should receive the first booster dose in 3 years, subsequent doses every 5 years.
Okay, that is a primary complement deficiency. Okay, next.
Children with functional or anatomic asplenia, hyposplenia, including sickle cell disease, administer 2 primary doses of either meningococcal conjugate vaccine with at least 8 weeks between the doses for the individuals aged 24 months through 55 years. Vaccination should ideally be started 2 weeks prior to splenectomy.
Okay, remember this for kill the vaccine for long-term immunity. If you are giving just 2 doses, it is 8 weeks. If it's a primary dose, the interval is 4 weeks. Okay. Now, remember, therefore, this is a killed vaccine. Remember, you might get a sickle cell anemia case when you go to Madras for a patient for your exam. Therefore, they will ask you what's the management. You must talk about immunization, very important. Pneumococcal vaccine, meningococcal vaccine, etc. Read human immunodeficiency.
Person with human immunodeficiency virus administered 2 doses at least 8 weeks interval. Laboratory personnel and healthcare worker who are exposed to routinely to Neisseria meningitis in solutions that may be aerolized should be considered for vaccination. A single dose of meningococcal conjugate vaccine is recommended. A booster dose should be administered every 5 years if exposure is ongoing. Adjunct to chemoprophylaxis. In close contact of patient with meningococcal disease, healthcare worker in contact with secretion, household contact, or daycare contact, a single dose of appropriate group meningococcal conjugate vaccine is recommended.
What I find funny is that they have not written what to do with patients with primary immune deficiencies, B cell deficiency, T cell deficiency. I can understand in T combined deficiencies maybe not be effective, but suppose there is primary B cell deficiency. will you not give MCV vaccine? They have written children with terminal component deficiency, functional acyclemia. They are not written about what you call as immunodeficiency. You understand? Anyway, meningococcal vaccine, I think, should have been said. They have not written about the indication. Now there's something coming up related.
The most cost-effective strategy was routine vaccination of children at 12 months of the age, combined with catch-up campaign for all children and adolescents less than 18 years of age.
This is given in IAP itself, I think. I don't know from where I quoted it. Anyway, read the next thing. See what is given in meningococcal vaccine here. See, what is given here is that in blue is vaccination special situation, and they are advising 9 months to 13 months. That means it is Menactra. Okay. This is IAP, IAP 2023. All right, the latest which we have.
What is,
Yeah.
what is the IAP recommended age cutoff for catch-up immunization of TDAP?
It's a stupid question because it is given as just the catch-up immunization should be given till 18 years. Suppose a 20-year-old person comes, do you give it? Because the immunization schedule are always given up to 18 years. That might, but here, see here, read the what is in the bracket.
In those children with whoever received all three primary and the two booster doses of DTWP, DTAP, TDAP should be administered as a single dose at the age of 10 to 11 years, and catch-up vaccination recommended till the age of 18 years.
Okay, till the age of 18 years, it is recommended. But I don't know why if a 20-year-old person cannot, because you're giving decennial, this one every 10 years, you're giving TDAP. Therefore, if you give it 10 years, you'll give it 20 years. Therefore, I don't know why you shouldn't be given at that. That's you just picked up the sentence and a question is asked. Anyway, now the questions are MCQ. I think we finished 30 questions. That was over, but few points were left out. Therefore, I put that for reading in. Measles, mumps syndrome. Okay, catch-up immunization. Can you read catch-up immunization? What's given here?
Ensure that
Catch-up
all school-age
Yeah, read it. Let's see, read.
ensure that all school-age children and adolescents have had 2 doses of MMR vaccine. The minimum interval between the 2 doses is 4 weeks. 1 dose if previously vaccinated with 1 dose. In campaign mode, MMR vaccine can be administered irrespective of the administration of previous doses.
That means 3 doses, 4 doses can be given. This advisory committee on vaccine immunization practice by the IAP. This is what happens in IAP. They don't want to go against the government in campaign mode. See, what's the point in giving 2 or 3 doses of a vaccine, MMR vaccine, just because you want to give a higher coverage? What happens in these campaign is whether it's a national program, OPV program, or anything. Many times the government wants maximum coverage. And what happens in these is people who have already taken the vaccine, they will come for taking the campaign. People who refuse vaccination, they simply don't come. Therefore, you are vaccinating the already, you are something like preaching the converted. You're already vaccinating the children who are already. Therefore, you cannot, as in campaign mode, you cannot, if you are a pediatrician, the parents come and ask, Doctor, I've already taken MMR vaccine 2 times. I've given MMR vaccine 2 times. Should I take it? 2 doses in school age taken. Well, the answer should be from a scientific point, no, but from a political point, probably it is right. You have to give it. Now, Emma vaccine is a part. Now, this is important to know. The catch-up immunization is only up to 5 years for Emma vaccine, but they're telling school-age children and adolescents have 2 doses of Emma. Catch-up means the first dose, just because you have not given. Can you read the last one? Last time.
Measles,
Yeah.
measles containing vaccines can be administered to infants aged 6 months to 11 months during outbreaks. These children should be revaccinated with 2 doses of measles containing vaccines. The first stage at ages 12 through 15 months and at least 4 weeks after the previous dose, and the second dose at ages 4 through 6 years.
All right. Now my question is something else. Let's go on to hepatitis A vaccine. There was no question asked. Now, is it what I mean? The hepatitis A vaccine is not given in the universal immunization program. Is it advised by the IAP? Simple question. Amal, you go to a health center. A mother comes and says, should I give hepatitis A vaccine? What will be your answer?
Yes, sir.
If she says the government is not giving, why you want to give?
Because if the child goes to for education purpose in hostel, outbreaks can come.
Okay, the answer to is has IAP recommended it to immunocompetent normal people?
Six months.
That's a different thing. I'm asking you, is hepatitis A vaccine recommended for immunocompetent normal children? Age is different. Okay.
Yes.
Yes or no?
Yes, sir.
Okay, now read the answer. The hepatitis A vaccine may be offered to all healthy children. Remember this. This is by the IAP recommendation. Where you can tell to everybody, better take it. But of course, patients with chronic liver disease, hepatitis B, congenital acquired immunodeficiency, transplant, etc., can be given. Now, at what age do you give it? Okay. Now, suppose a child, what age is it usually given? Can you tell me? Minimum
months.
age, huh? 6 months.
6 months.
No, it's some other vaccine which is given at 6 months. That's also enteric, or this is hepatitis A. What do you say? Now, suppose a 18-year-old boy comes and says, Doctor, I'm going for the hostel and should I take hepatitis A vaccine? What will be your answer to that?
Yes, sir.
Okay. Or will you do the antibody titer and check? What does IAP say?
Vaccination should be done before going to hostels.
Hospital. Yeah, if he's immune, why should I? I mean, if you had a subclinical hepatitis A, I would be immune. Many children become immune, 50% they say by 10 years. Many persons become immune. Will you take the antibody titer and then give if he is negative, or will you give it straight away?
Straight away.
Straight away. Okay, read it. Therefore, inactivated vaccine more than 12 months. Therefore, your age of 6 months is not with hepatitis A. Okay. The catch-up immunization. Okay, read it now. Routine. Can you read it?
Routine vaccination,
Yep.
inactivated vaccine more than 12 months. 2 doses administered intramuscularly at 0 and 6 to 18 months. Live vaccines more than 12 months. Single dose administered subcutaneously. Catch-up vaccination, inactivated vaccine, 2 doses administered IM at 0 and 6 to 18 months. Live vaccine, single dose administered subcutaneously. For catch-up vaccination, pre-vaccination screening for hepatitis A antibody is recommended in children more than 10 years. as at this age, its estimated seropositivity rates exceeds 50%.
Therefore, where in you practice in Asta, where everybody comes there and pays lakhs of rupees as fees, you should definitely give the best advice. I don't know whether vaccine antibody can be tested. You will have to do it. If it is positive, there's no need to do it according to ACPP. Okay. I think the next. There's something coming up. What is that written there?
Since the cost of screening to identify those susceptible to hepatitis A infection is lower than the cost of vaccine, IAP SCVAP recommends pre-vaccination screening for hepatitis A antibody in children over 10 years.
Okay, when you practice in a good center where you want to give the best of care to your patients, it is better to do it that way. Okay, now next is typhoid vaccine. What is the minimum age at which you can give it? Is it advisable to give to everybody? Every child? How many vaccines will you give?
IAP recommends typhoid vaccination.
At what age?
1 year.
1 year. Amal, you have this purple book with you?
And sir,
DCH Bhasa Kenya, please go through it very carefully. Okay. When you practice pediatrics, one of the most important things you practice is immunization. Whatever advice you give should be on the dot. Then only people around you will respect you. Is typhoid vaccine? Somebody comes and asks, should I give typhoid vaccine or not? The moment you say it's better to take them, don't say it like that, doctor. They will even ask you, it's your child, will you give? Amal, will you give your child? Your child is now 4 months old?
6 months.
Yeah. What age what vaccine should you give now? Typhoid vaccine is to be given at 6 months, according to this one. Now read it now. Yeah. Can you read it?
IAP recommendation typhoid vaccine. Both VI polysaccharide vaccine and VIPS conjugate vaccines are available. Minimum ages VIPS typhoid conjugated vaccine 6 months, VIPS polysaccharide vaccine 2 years. Vaccination schedule VIPS polysaccharide vaccine single dose at 2 years. Revaccination every 3 years. No evidence of hyporesponsiveness or repeated revaccination so far. VIPS conjugated type bar TCV single dose at 9 to 12 months. Catch-up vaccination recommended throughout the adolescent period, that is till the 18-year IAP.
Yeah.
Prefer the use of VIPS conjugate vaccine.
All right. Now my question here is you keep on telling polysaccharide vaccine, which requires every 3-year dose, and there's a conjugate vaccine. Why do you require both of it? Because can you give any idea? I am a little surprised that the single dose is given at 9 to 12 months. All right. I think the universal immunization schedule, the IAP immunization schedule gives it at 6 months. I will check it up later. Okay. Till 18 years, you can give it for life actually. Why do they keep on talking of polysaccharide vaccine, which can be given only after 2 years, and you have to give it every 3 years because of the reason that it is cheaper. But remember that nowadays, single dose of 9 to 12 months typhoid vaccine. Typhoid vaccine is a live vaccine or a killed vaccine? Amal,
Killed vaccines.
killed vaccine. Then why do you give a single dose, Rose? How can you give a single dose of a killed vaccine? How will it be effective? You can understand a live vaccine being given single dose. Actually, previously they were talking of 2 doses. They were even talking of 3 doses with booster. Suddenly they made it 2 doses. Now the IAP has come about with the recommendation of a single dose. Conjugate vaccine and not Rose, can you tell me why single dose typhoid vaccine? Any idea?
Yes, sir.
See, the answer is not given, but in between lines, if you read, they say that you get your booster through your food. That means we are eating salmonella to our water and food, and therefore in developing countries, there's no need for booster. That is the explanation given. And they're quite sure. Therefore, when they came with a single dose, I was fighting with the pharmaceutical company. How dare you say that? It goes against the basic immunization principles. But when I find it that the IAP itself has recommended it, you can go ahead and give a conjugate vaccine as a single dose. Why are they talking about so much of polysaccharide vaccine? Because polysaccharide vaccines are generally cheaper. That is what the reason is. Now, what do they mean? No evidence of hypo-responsiveness or repeated vaccination so far. What do you mean by that? Which polysaccharide vaccine has hypo-responsiveness? Amal was not attending. Rose probably missed those things. Rose, can you answer? You are there?
Yeah.
Okay, Rose. Now I'll give you the vaccine PCV23. Okay. PCV23, which patients do you give PCV23?
In immunocompromised only.
Which
More than 2 years.
More than 2 years. Patients with splenectomy, especially immunocompromised patient, you give PCV23. How many doses do you give?
Single dose.
Amal, how many doses do you give?
അറിയില്ല.
എന്താ സമയം കഴിഞ്ഞു. They're going to give you your DCH. Okay. Now the question is that PCV23 is given at the age of to children with splenectomy, immunocompetent patients, etc. Is given to as a senior citizens at 50 years. The immunization that is advised is PCV13 and then followed by a PCV23 after 8 weeks and influenza vaccine every year and a dose of herpes zoster, 2 doses. I think it's 2 doses of herpes zoster. But they advise only 1 dose of hepatitis PCV23 at 2 years. Maybe you can repeat it once at 5 years, but you cannot. It's a polysaccharide vaccine. The antibody level does not last, but still they don't say don't give the vaccine again. Why? Because there is something called hyper-responsiveness. The more vaccine you give, the antibody level will go down in polysaccharide vaccine. That seems to be happening in PCV23, but the same polysaccharide vaccine, there's no evidence so far that typhoid vaccine polysaccharide causes the problem. This is all theoretical because we are not going to give polysaccharide vaccine, and I'm not sure it's available also. You give the conjugate vaccine once, it's given 9 months. Let me check the above 18 years also, probably you can give typhoid vaccine. Why is this typhoid vaccine WHO so much interested? Because we hardly see any typhoid, is it not? Amal, in your 2-year training here, did you see a blood culture proved typhoid vaccine?
Yes, sir.
You saw one. Oh, you're great.
Mm.
You saw blood culture proved typhoid vaccine, huh?
Anju madam and patient was there.
Okay. Why are they so concerned about typhoid? When it comes, you can treat it. Rose, what's the problem?
Carrier
Especially
state.
multiple drug resistance is a huge problem. And in fact, in many patients in Pakistan, no drug is effective. No drug. Can you imagine? Children die of typhoid. You diagnose typhoid in a Pakistani child, the parents and the doctors back home started worrying very much. Now, my next question is Japanese encephalitis. I think it's Japanese encephalitis. Will you give vaccination or not?
Yes, sir.
Rose, you are giving that? At what age you give? What is the dose?
No, sir.
You are not give. It is recommended or not recommended?
പിന്നെ തിരുവനന്തപുരം and ആലപ്പുഴ districts.
Yeah. That's what I also thought. Trivandrum, and wherever there is an endemic area, at what age you give how many doses?
16 to 24 months.
10 to 24 months. Okay. Now, this is what I also thought, but the age I'm not sure. Let me put it up. Read only
9 months.
into the endemic areas. What is the age? Urban children. The 3 types of vaccine have the 2-dose schedule. First dose at 9 months, along with MR vaccine. And according to a typhoid vaccine, second dose is 16 to 18 months. That is with DTP booster. Minimum age is 1 year according to some other vaccine. I don't know which one we have, live or I think we have the live vaccine, isn't it? During an outbreak, all children up to 15 years were ahead of an anticipated outbreak or campaign. Rose, is there an outbreak in Calicut?
ಇಲ್ಲ sir.
Illa, sir. But yesterday, Asianet, I saw from Canada. 2 districts in Kerala have been advised to take Japanese encephalitis virus. You know what those 2 districts are? Malappuram and Calicut. You check it with your people there. You must know what you're doing because you shouldn't miss. I mean, of course, in the government sector, they would do what is required. And what is advised at the age at which it is given? The current national immunization will go to that good
9 months.
9 months. Okay, MR, PCV 13. But where is the typhoid vaccine? Typhoid vaccine is not there in the national immunization. Okay. And I've written something else. JE vaccine is completed 9 months to 12 months. JE2 16 to 24 months. Let's look at what they say about this is a national immunization. Typhoid is not there. Hepatitis B, BCG, typhoid is not there. JE vaccine to select endemic areas. So, okay. Now let's look at this I think in the Indian Academy of Pediatrics. Typhoid vaccine, single dose. Oh, this is adolescents and thing, okay. Pneumococcal vaccine, PCV may be administered to children aged 6 to 18 years. Which PCV can you give? Which PCV can you give? Any idea? Dr. Rose, if you want to give a person who is 20, he is about adult, 50 years, which PCV will you give? PCV 10, PCV 13, Rotacil, Rotavac, which can you give? Not
Is-
Rotavac, I mean pneumococcal vaccine I'm asking. Pneumocil, Pneumocil will you give? You see, will you give Synflorix? Will you give PCV 13, which is new, which is, I forget the trade name first. Which one will you give?
PCV 13.
PCV 13 is the one which is given above 5 years, is usually PCV 13 for adults also. Here it's important to remember whenever you give pneumococcal vaccine to children aged 6 to 13 years, anatomical asplenia, etc., a single dose of PCV is given, conjugate vaccine. At least 8 weeks of the La PCV to children 2 years and under. This is very important in children with the cochlear implant because when you do a cochlear implant, huge amount of pain is, I mean, people are spending a lot of money and then this problem arises. Therefore, you must know how to deal with it. It's already 8:52. Okay. Therefore, they say that you should give 1 PCV, 8 weeks later, pneumococcal polysaccharide vaccine 1 dose, and you might repeat it once after 5 years, not after that. Now, regarding the typhoid vaccine, I would like to, I'll finish the show and see whether it is there. Stopped as a share window is closed. Okay. Screen scaring is not. Majida is there. Rose is there. All Lasima left. Now let me see whether this. I just want to make sure whether what is the IAP schedule. IAP schedule is the IAP schedule is here. I'll put it up. And I think now you can see the screen, is it not?
Yes, sir.
What does it say about typhoid? It's not here. Huh? This is IAP.
TCV.
Wait, it is.
TCV. When does it say? Yeah, it says
6 months.
recommended 6 months onwards. See, this is where I am mistake. That's what I remember clearly. 6 months is what it is given. There, in that schedule is given at 9 months. See how it somebody can cross you and say, therefore, almost it's time, but no need to take at 6 months, Amal. You can wait till 9 months and give the vaccination. Even you can postpone it later because the child is going to be at home and he's not likely to get typhoid, and typhoid is very, very rare here. Therefore, when this child starts, but it is better to give at some stage or the other. I think we have finished. There's only 6 more minutes. We cannot go into a next one. I'm not sure the next time I'll be. See, I have asked you to send me. Rose, did you prepare anything?
Sir, I'll send the answer.
Okay, now I'll stop the recording first thing. Remote control.